my name is Susila Thapa. I am a family nurse practitioner student at Indiana State University. Today I am going to perform your physical examination. Is that okay with you?
Yes.
What is your name
John Smith,
and your date of birth?
February 10, 1980.
Okay, thank you. So at the beginning, I'm going to start with your thoracic inspection. So I'm going to inspect on your front side here, and then your back side here, and then I'm gonna check your respiratory rate, rhythm, and then I'm gonna see if you are using any accessory muscles or not. I have to check your respiratory rate for 1 minute. Okay, respiration is 19, and your rate is regular, rhythm normal, and then you're not using any accessory muscles, which is good. Now I'm gonna do this palpation to see that if you have any lesion or tenderness. I don't see any lesion and tenderness. And now I have to do the anterior and posterior thoracic expansion. And I'm pressing this. Can you take a deep breath for me, please? And then I'm gonna do your back. Can you turn back, please, for me? Thank you. Take that more deep. Okay. Can you take deep breath for me? Okay, so I can see the equal movement when you take in and out. So I'm gonna do now percussion. So I'm gonna start from the apex of the lungs to the base, and to see that if you have a resonance, hyperresonance, or any dullness. Laterally. This side too, and I'm gonna do your back too. And on your left side, lateral side here. Perfect. Can you turn front for me, please? And I'm gonna listen your lung sound now, and I'm gonna start in from the apex of the heart here. Can you take a deep breath for me? And I'm gonna listen on your back, starting from apex of the heart to the base. Take a deep breath for me. Can you lift your leg up here? And then this side here. Thank you. Now I'm gonna start your cardiac, and we have a 6 area of assessment. So the sternal here, the second intercostal space, the right side is aortic, and then second intercostal space left side is the pulmonic, and then down to the third intercostal space, that's the arse point, and then down to the fifth intercostal space, that's the tricuspid, and then between here and the sixth intercostal space, that's the mitral, and then we have epigastric down here. So when we hear the cardiac sound, I mean when we hear the sound, then we have to hear the aortic, pulmonic, that the area I described, and then on the aortic and pulmonic we hear locked up sound, and then where S1 S2 is louder in aortic and pulmonic, and arse point there is no specific valve, but we hear S1, S2, and then on the tricuspid and the mitral we hear S1, S2, and but where S2 is the loudest, and then on the mitral there is a something special where we get the impulsive pulse, and then that apical pulse we normally hear there 1 minute, and then apical pulse normal rate is 60 to 100. So now I'm gonna palpate your the area to see if you have any hive, thrill, or PMI pulsation. PMI. don't see any hive, thrill, or PMI pulsation. And now I'm gonna listen your heart sound, the area I described on the 6 areas, when you are sitting, when you are laying down and supine. And I'm gonna use the diaphragm of my stethoscope and then repeat with the bell of my stethoscope, okay? You can breathe normally here. Starting from here, this is aortic, this is pulmonic, arse point, tricuspid, mitral, and then so on those 5 area I hear S1, S2, I did not hear S3 and S4. And then this is epigastric, we check here if we get a swishing and blowing sound. I don't hear any. I'm going to repeat with the bell of my stethoscope. Aortic, pulmonic, arse point, tricuspid, and mitral, where I'm going to hear your apical pulse 1 minute, which is 68, which is normal, and then here epigastric, and I don't hear any swishing and blowing sound. Could you please lay down for me? And I'm gonna do a supine position, listening. Those all 6 areas: aortic, pulmonic, arse point, tricuspid, mitral, and then epigastric. On those 5 areas, I hear S1, S2, aortic, pulmonic, arse point, tricuspid, and mitral. I did not hear S3 and S4, which is normal. And then on this epigastric, I did not hear any swishing and blowing sound. I'm going to repeat with the bell of my stethoscope. Aortic, pulmonic, arse point, tricuspid, and mitral, where I did not hear S3 and S4, which is normal. And then epigastric here, I did not hear any swishing or blowing sound. And then could you lay down on the left lateral position? I'm going to repeat again from aortic, pulmonic, arse point, tricuspid, mitral. I did not hear any S3, S4, and S3, S4 is not normal for the healthy individual, but S3, S4 can be here for the athletic people. And then this is epigastric. I'm going to repeat with the bell of my stethoscope. Aortic, pulmonic, arse point, tricuspid, mitral, where I hear S1, S2, I did not hear S3, S4. And then this is epigastric, where I did not hear any swishing and blowing sound. Thank you. And now I'm gonna palpate your, I'm gonna observe and then palpate and listen your carotid artery. First on this side, I'm gonna see the side and compare. I don't see any distension or any kinkade artery there, and I'm gonna feel with the index and middle finger. I'm gonna palpate your artery. I can palpate here, they are +2, which is normal, and then I can feel on this side too, and that's +2 normal. And I'm gonna hear your auscultate your carotid artery with the bell of my stethoscope to hear if I hear the diaphragm, I can hear extra sound, so I'm going to use the bell of stethoscope here, listening, and then I'm going to compare the side. Yeah, I can hear. So now I'm going to feel your pulse. First I'm going to feel the radial on your both arm, and then brachial here, I can feel on your both arm, and then I just need to do your popliteal below the knee, and then dorsal pedal is here, and then tibia on the back side here. Thank you. Now I'm gonna move to the, we call it hint, your head, your general skin overview, and then your head, nose, ear, throat, and then your head, ear, eyes, nose, and then your throat. So I'm gonna observe your skin first. Here I'm gonna say skin turgor, texture and temperature, as is nice. And then nail, capillary refill is good, nail without clubbing. So on your head, that's the skin. There is no lesion and no alteration, which is good, and your skin is nice and warm. And on your head, I am skipping this procedure. But I'm explaining what I would have done. So on your head, we normally palpate your scapula and then see your hair distribution and see if you have any lesion or tenderness. And similarly, we palpate the sinus, frontal sinus, and then we palpate the temporomandibular joint. We call it TMG, and we auscultate the artery there, temporal artery, and then we palpate, feel, and then we auscultate that. And then on your eye, we're gonna see your eyebrow, your eyelid, your conjunctiva, if they are equally symmetrical or not, and if there is any abnormalities like discharge, any redness, any extra masses. And then similarly on the eyes, we do the direct and consequent response. When I put the light, then your eye, your pupil constrict. That calls direct response. And when I put the light on your own eye, and then another eye's pupil also constrict, that call response. And then on the ear, we just normally check the outside of the ear if there is any masses or any pain, and then either they are symmetrical or not. And then see the inner canal if there is any infection or blockage. And then inside the ear, we're gonna see that tympanic membrane. It normally pale color and no infection. And then we normally check the functional hearing test. And then on the nose, you're gonna check on your outside of the nares, see if you have any abnormalities, if your nasal is deviated to one side or not, and if there is polyp. And then similarly inside the nose, we're gonna see the mucus, either they are moist pink or not, or if there is polyp or there is any infection. We're gonna see the inside of your nose. And then on the mouth, we're gonna see the lips and the inside of the lips, if they are like moist, bluish color, crackle. And then after that, inside the mouth, we're gonna see the tongue, we're gonna see the teeth, and then we're gonna see the all over your mucous membrane inside the mouth. And then on the neck, we're gonna we're gonna observe the arteries and the vein there, if there is any distension of the jugular vein or any abnormalities, and we're gonna compare the size. And then in the neck, we're gonna see the trachea, if it's in the midline or not. And then similarly, we normally test the thyroid, and then we asked you to swallow when we feel the thyroid. And then we have a lymph node there, and then we check the lymph node that submental, submandibular, tonsillar, in front of the ear preauricular, backside of the ear postauricular, occipital, and anterior superficial and deep cervical chain, and then supraclavier. So that's all about the head, ear, eyes, nose, and throat, and including neck. Do you have any problem on those area? No. And thank you so much. Now I am moving down to your abdomen, and then first I'm gonna inspect your abdomen, and I don't see any ascites or any abdominal distension or any engorgement or anything. So on the abdomen, we normally do inspection and auscultation and percussion and palpation. So I don't see any abnormalities during inspection. I'm gonna auscult your bowel sound first, starting from the right lower quadrant here and to the right upper quadrant and left water quadrant and then left lower quadrant. I hear the bowel sound. Those are 5 to 30 per second. And then similarly, I'm gonna listen the arteries there. This is a aortic artery, and I'm gonna listen here renal on the both side, and then down here iliac on the both side, and then on here femoral on the both side. So that's the auscultation, and I'm gonna focus your abdomen for any dullness or anything. I'm moving to the clockwise direction starting from the right lower quadrant. Okay, so now I'm gonna auscultate this. Right side is a liver, we got the left side is the spleen. I'm gonna focus here on your liver side, and then I'm gonna focus here on the spleen side. So I don't see any abnormality, and then now I'm gonna palpate your abdomen starting from the right lower quadrant. I'm gonna first do the light palpation and let me know if that hurts when I palpate. And I'm gonna do the deep palpation and then using my another hand too. Okay, I don't see any abnormalities, and I'm gonna palpate your spleen down here. Okay, I don't feel any enlarged spleen, and I'm gonna feel your liver down here, and I don't see any enlarged liver too. Now I'm gonna take that the four sign. One is Murphy sign, McBurney sign, iliopus muscle test, and orbital muscle test. So I'm gonna palpate here. Let me know if that hurts. So that's the Murphy sign. Do you feel pain? No. And this sign is a McBurney point. That's for the check for the appendicitis. Do you feel pain here? No. And then let me know if you feel pain there when I lift your leg like this. Do you feel pain here?
No.
And that's the iliopus muscle test and orbital muscle test. I'm gonna put it here like this, and then let me know if that hurts here. Does that hurt?
No.
Okay. And now I'm gonna do the CBA, rebound tenderness. So let me know if you feel pain or discomfort here, okay?
Mm-hmm.
I don't feel any tenderness down there. And then I'm gonna palpate your aortic pulse here. Yeah, I can feel your aortic pulse. And do you mind to sit up for me, please? I'm gonna check your CBA tenderness. Let me know if you feel pain or discomfort here. Do you feel pain?
No.
So that's for the kidney check if you have a pyelonephritis or something. Thank you so much. Now I'm gonna move the musculoskeletal. I'm gonna see the joint and muscles, and I don't see any abnormalities. I don't see any joint impairment, and then joint problem. And then I'm gonna go and check your neck, and can you do the flexion, and then see up here extension, and then lateral on the both side, and then rotation. Can you move your head like this? Yeah, that's the neck range of motion. And then now I'm gonna do the shoulder, and then flexion this over front, and then extension all the way back, and then internal rotation to this, and then external rotation all the way back there. So that's the shoulder range of motion. And on the elbow, a flexion, extension, flexion. You can do both arms. Flexion, extension, and then supination and pronation. So that's the range of motion of the elbow. Thank you. So now I'm gonna do the wrist flexion, extension, and then move to this side. That's the away from the body abduction, and this side is bringing to the body this adduction, and then your finger flexion, extension, abduction, go to the away from the body, and then bring them away, near to the body. And that's the the wrist. And I'm gonna do your hip. So the hip, this is a flexion, and then this is a internal rotation, this is external rotation, and then abduction is a near to your body, and adduction is away to your body. And can you lay down prone for me, please?
Okay.
Prone. And then this is a hip extension. Thank you. Now knee flexion. Can you sit on the side of here? Knee flexion, extension. That's good. And then ankle flexion, dorsal flexion, and export and invert here. So flexion, bent, and then extension back, and then lateral on this side, and then move your rotation. That's the vertebral column. Thank you. So I'm gonna do some couple of tests. So first test is crossover body test. So put your shoulder like this, cross here. So do you feel pain or anything on your shoulder?
No.
So no. So that test is negative. So this is the test for the rotator cuff injury. Thank you. So another test is F-less test. That's again for the rotator cuff injury. So try to toss on with hand this, and the similar to the other side, opposite. Do you feel pain or any tenderness on the shoulder?
No.
So that's the test is negative. Thank you. Now I'm gonna do another test called near impingement test, and I'm gonna put my hand on your scapula, and then I'm gonna slightly internal rotate your arm, and then just lift it up. Do you feel pain or anything?
No.
So if you don't feel pain or any tenderness down there, that's the negative for the near impingement test, and this test is done for the rotator cuff injury or any impingement disorder. Thank you. So I'm going to perform another test called Hawkins impingement test to see the this is test done to see that if the patient has an impingement disorder. So what I'm gonna do is I'm gonna just flex your hand 90 degree like this, and then passively internally I am gonna internal rotation. Do you feel pain?
No.
So that means that test is negative. Now I'm gonna do your external rotation leg test. But to do that, I'm gonna abduct your hand like a 90 degree like this, and then I'm gonna flex your shoulder 45 degree, and then you have to hold the hand when I leave my hand down there. Okay.
Yep.
Try to hold the hand like this. So he maintained this health. That means he's negative for the external rotation leg test. So this test is done for the rotator cuff injury. Thank you. Now I'm gonna perform the drop arm test. So I'm gonna put your hands like this 90 degree here, and then I'm gonna leave the arm, my arm, and then can you just slowly move your arm down? Yeah, so he maintained that position. That means he's negative for the drop arm test. Now I'm gonna perform empty can test on you. Can you put your hand like 90 degree and flex your thumb down, and then I'm gonna put a pressure here. Do you feel pain?
No.
No, I didn't feel weakness. So he's negative for the empty can test. If he feel pain and if I feel weakness, that's the positive test. Thank you. Now I'm gonna do the some test for the carpal tunnel syndrome. The first is Finkelstein test. Can you make a fist, putting your hand inside, and then I'm gonna extend that. Do you feel pain?
No.
No. Can you open? Do you feel pain here?
No.
No. So that means he's negative to the Finkelstein test. Thank you. Now I'm gonna test the wrist tinal test. I'm gonna extend your arm here, and then I'm gonna palpate here. Do you feel numbness or tingling down here?
No.
So that means that you are negative for the carpal tunnel. And then I'm gonna another test gonna be wrist frenal test. Can you do the reverse prayer position like this, like this, like this, and then can you press your arms inside. Do you feel tingling and numbness here?
No,
So
nothing.
that means negative for the carpal tunnel syndrome. Now I'm gonna perform the McMurray test. For that, I'm gonna put your knee fully flexion. I'm gonna put your hand there, and then I'm gonna put your knee extension this way. I'm gonna try a different angle. Do you feel any pain or crackle there? So
No.
McMurray test is negative. Thank you. Now I'm gonna perform the valgus stress test. For that test, I'm gonna put one hand like this here next to your ankle, and one hand to support your femur here, and I'm slightly push away from your body, which is abduction, and then see if there is any gap. Pain? Do you feel any pain?
No.
I don't feel any gap. So negative for the valgus stress testing. Now I'm gonna perform the varus stress test. For that, I'm gonna put my hand like this, and then now I'm gonna support another hand here, and then I'm gonna passively adduction, that's to your body, to give pressure to the knees. And do you feel any pain or any?
No.
Is negative for the varus stress test. Now I'm gonna perform anterior and then posterior draw-san. For that, I'm gonna flex your leg like a 90 degree, and I'm gonna hold my hand like this, and then I'm gonna pull your tibia anteriorly. Okay, and then for the posterior draw sign, same thing. I'm gonna put my hand like this. Your leg is a flexion, knee is flexion, and then I'm gonna push the tibia posteriorly. So that's the posterior draw sign. Thank you. I'm gonna do another test called Lancome test. That's for to check for the ACL tear. For that test, I'm gonna put your leg like a 30 degree flex. I'm gonna put my hand here, another hand here. I'm gonna slightly rotate your leg this way, and then I'm gonna move my hand here and pull your leg. Do you feel any pain and discomfort?
No.
Okay, he's negative for the Lancome test. Thank you. Now I'm gonna do the straight leg test. For that test, can you lift your leg as much as you can? And then during this test, if the patient patient complain pain below the 45 degree of angle, then that's the suspected for the sciatica or herniated disc. Do you feel any pain or any tenderness? So he is negative for the straight leg raise test. Now I'm gonna perform the cane test. For this test, I'm gonna extend your shoulder like this, and then I'm gonna flex and rotate your shoulder in one side. Do you feel any pain or anything?
No.
So this is test for the lumbar stenosis. Now I'm gonna perform the fear test. For that test, I'm gonna flex your hip and knee 90 degree, and I'm gonna put my hand here, and then one hand here, and then I'm gonna like push up as a 45 degree. And do you feel pain on your back?
No.
Now if you feel pain on your back, that's the problem with sciatica, and he is negative for the fear test. Now I'm gonna perform the thigh throw test. For that, I'm gonna put your hip 90 degree with the leg slightly abduction, and then I'm gonna put another hand to your sacrum here, and then I'm gonna press like 3 times. Do you feel any pain or any discomfort in your back?
No.
No, so he's negative for the thigh thrust test. Thank you. Now I'm gonna perform the fader test. For that test, I'm gonna flex your leg 90 degree, and then I'm gonna adduct your leg, which is adduct is this way, and then internally rotation I feel like, do you feel pain
No.
anywhere? No, so you be negative for the fader test. Now I'm gonna do the favor taste. For that, I'm gonna put your leg like this here, and then leave it loosely like this, and I'm gonna put one hand to here, and then I'm gonna press this down here, and then the taste is positive if this leg remains above the opposite leg, but you are negative for the favor test. Now I'm gonna move to the neuro examination, and then I will do your mini mental test at the last. So first I'm gonna check your pupillary reaction to light, and see straight down there. Yeah, they are reactive to light, and then they are equal. And then I'm gonna move to the coronal reflex. Yeah, they are normal. And then just check here. I'm gonna gauge of your eye here. Okay, perfect. And then I'm gonna take a facial nerve. Can you raise your eyebrow? Can you close your eyes? And can you smile? And can you frown? Can you show me your upper and lower teeth? Okay, can you make a cheek puff out? Yeah, that's perfect. And then you can you say ah? And I supposed to see that movement of your pharynx and alva. Since you are in a max, I can't see, but I'm just assuming that I saw and it's normal. So now I'm gonna do the whisper test, and I'm gonna whisper some word and letter, and tell me what you hear. Okay?
9OL.
Okay, that's perfect.
52K.
Yeah, that's perfect. So that's the that's all about whisper. Now I'm gonna take your sternocleidomastoid muscles, so which is on this side here. So what I'm gonna do is I'm gonna put my hand here, and then your face is lifting on the chin, and can you just simply lift your head up? So I see that your mastoid muscles is working there. Now I'm gonna check your muscles in strength, cervical muscle strength and lumbar muscle strength. And can you push up, and can you push down, and can you push in, and can you push out, and can you squeeze my finger? So the spinal muscle strength is 5/5. Okay, for the muscle strength and the lumbar one, can you push in, can you pull back, and then can you push out, and then can you push me down? So that's a lumbar muscle strength also 5/5. Now I'm gonna check your coordination, and then I just wanna start with your gait. Can you walk for me down there and walk back? Can you walk with her heel? That's good. That's perfect. With your toe. Yeah, that's good coordination. And then tandem walking, like with your heel to sing. Heel to toe. Okay. That's good. Perfect coordination. Thank you. Now I'm gonna take your rapid alternating arm movement. Can you do this like fast? That's perfect. That's good coordination. And then I'm gonna do the head to sing with your nose. Just like do this. Toss my finger. Nose. Like yeah, this, yeah. Toss your nose and then toss here with your finger. Yeah, there you go. On another hand. That's perfect. And then another one is heel to sing test with your heel down there, and the same with this leg. Yeah, that's perfect. Now I'm gonna test your rumba test, and can you put your legs like this, and then can you close the eyes and stand straight? Okay, there's you maintaining your coordination, that's good. And then can you lift your arm like this? Okay, and you maintaining your arm, it's not drafting, that's the pronation draft. Perfect, thank you. Now I'm gonna take some reflex on you. So first is a bicep here. I'm gonna feel it, and then tricep on your back here, and brachioradial here, and the patellar here, and then ankle here. That's perfect. Now I'm gonna take a clonus reflex. So for that, I'm gonna simply dorsiflexion of your neck, leave. So this is negative. I'm gonna take your Hoffman sign now. Okay. So I'm doing a plantar response and then Babinski sign. Okay, that's the plantar response and then negative Babinski sign. Yeah, I'm gonna do the mini mental examination. Do you know what year is it
2021.
and what season?
Winter.
And then which month
December.
and date?
December 18.
And what time is it?
I don't have anything to check. Probably 6 p.m.
Which country we are in?
USA.
And which county?
Hamilton.
Okay, I'm going to give you 3 objects, name of 3 objects, and then repeat the. After I finish, just repeat that. Okay, apple, penny, table.
Apple, penny, table.
And then can you subtract 10 from 50?
Yeah, 40.
And 10 more.
What 10 more?
Like for to subtract 10 from 40.
30.
Okay, and can you tell me what those 3 words were?
What 3 words?
I told you 3 words.
Apple, penny.
Okay, apple, penny, table. And what is this?
Pen.
Okay, and then what is this?
That's uniform.
Okay, and then can you read this sentence for me and do what is writing here?
Place your hand on your chest.
Okay, can you do that? Okay, and then can you write one sentence for me, please? You can write any sentence. That's perfect. Thank you. Can you draw the object next to it?
What object?
Here, this one. Yeah, that's perfect. Thank you. That's all for today's physical examination. Thank you so much for your time.
Thank you.